Hey, so glad to be back with you again. Happy that you are with us and grateful for spending some time with you this morning as part of your very busy Saturday morning. We begin today with a conversation that, quite frankly, might make some of you just a little bit uncomfortable. There is a new drug-free treatment available for erectile dysfunction. Now, millions of men suffer from this problem. I mean, that's why Viagra and Cialis are billion-dollar drugs, right? They wouldn't be if this wasn't a huge problem suffered widely. But instead of taking a pill, we're going to spend some time today talking about a treatment that uses sound waves that help increase blood flow. So we're going to be talking about the mechanics of male anatomy and some issues around that. So if that makes you uncomfortable, fair warning. Just wanted to get that out there so that you know what's ahead as we talk with the founder of ED Clinics of Indiana. He is Dr. Gregg Hough. Good to have you in the program today.
Thank you.
All right, so what makes this treatment different is that it addresses the cause of erectile dysfunction and not the symptom. So let's start there. Tell me, how do sound waves help fix ED?
Well, sound waves stimulate the growth of tissue as you explained the other day, we talked about it. If you go to the gym and you exercise your bicep again, it stimulates the muscle, it irritates it, it tears it down. But the human body, when it sees a need, it will grow to meet that need. That's how we're made. And so the sound waves stimulate the blood vessels, the connective tissue, and the veins all around the male anatomy to make it stimulate and regrow. The sound waves irritate the tissue, and they heal and they become stronger.
So that concept is applied using sound wave therapy is applied to a lot of different things.
Yes.
Plantar fasciitis, rotator cuff injuries, lots of orthopedic tissue damage is resolved by sound wave therapy.
Yep.
So you're just bringing that concept to erectile dysfunction.
Yep.
And this is something that's big on the East and West Coast, but I'm not aware of it being offered elsewhere here. Are you?
No, I looked quite a bit. I was surprised, really.
Well, let's jump into what the experience has been so far. How are men responding to this? How often do I notice something change, and what will I notice first?
Well, the standard treatment is 6 sessions. Someone maybe in their 70s might need 8, maybe 10. Okay. But usually what will happen within the first couple treatments, men will start waking up at night with a partial erection like they used to when they have to use the bathroom. If they had been trying to take Viagra or something else that didn't work, they'll notice that after I tell them, I say, when you start to notice that you're having a night erection, try the Viagra. And a lot of times when it didn't work before, the blood vessels are starting to be restored enough that the Viagra will start working again. And then I tell them, well, you take that because it's going to stimulate and help strengthen. As we do the treatment, it's going to help strengthen the healing even better. And so then after a while, they'll find that if they take a Viagra once a week, that everything will work all week long. Because it's just enough, and then they'll find that it'll last longer and longer.
Right. So let me walk through some of the anatomy involved in all of this, because, I don't think men really understand what goes on in that process. So when your body is trying to prepare itself for sex, there's some tissue in your penis called the corpuscle cavernosum. It's a spongy kind of tissue, and blood flows in and causes that to expand.
Yep.
And so that's what causes the erection. And then the pressure of that tissue against this encapsulating tissue squeezes down on the veins, which drain blood away, and then traps the blood.
Right.
So you can have a problem on two ends. You can either not have enough blood flow to expand that cavernosum, or you can have a problem with maintaining that expansion and that erection. Right. So does this work on both sides of that problem?
The sound waves restore all tissue. It's amazing. They've even done work with people with heart trouble. They'll put the machine right on the heart. Yeah. You've read some of that.
I have studied that.
And so, like with the rotator cuff tendonitis, it addresses the blood vessels, it addresses the muscular tissue, it addresses the tendons and ligaments. So it will restore and stimulate any tissue to grow and become better.
Okay. So I'm going to have, you said 6 treatments. And then how long does this benefit last?
That's I think it depends on your health. I mean, if you walk barefoot and get a blister on your foot, and you get off and your blister heals, and you walk barefoot again, you might get another blister. What I'm saying is, if you take care of yourself, if you do some exercise, you eat well, you keep your heart good, you keep your blood pressure well, a lot of it depends on your physical condition. If a person has diabetes, it's shown to be quite effective, but it only seems to last a couple of years. You know, you have to realize you're getting older. Some people, they say that it lasts for the rest of their life. It all varies on the health of the person.
Okay, well, that makes sense. Yeah, general health. I mean, cardiologists have told me often that erectile dysfunction is a good indicator of your overall cardiac health. So I get it. If that's a mess, then this isn't going to be as effective. So
there's no free lunch. You have to take care of yourself. If you go to the dentist and get your teeth fixed, you go home, don't brush them. It's not going to work. You have to take care of you as a person. This will open you up to be able to do what you used to do, and then it's up to you to try to maintain yourself.
So 52% of men over age 60 have this problem, according to one study I looked at. But you're treating a lot younger men. This is kind of a surprise to me.
Yep. Society is, I think it's a lot because of our processed foods. It's hard to say. The activity of our life, I'm not sure. Emotions, steroids, stuff that come in the plants and everything through what we eat. But I'm treating a 35-year-old right now. I've had a 42-year-old. Luckily, what's good for these younger men is they respond much quicker because their blood supply and everything is just starting to wane. You get a guy in his late 30s or 40s, and he's going, "Oh my gosh, I'm not being able to perform with my wife anymore." Well, he's only been maybe 6 months or a year away from when he could. You get a guy 70 or 65, it might be 4 or 5 years since he's been really able to function like he would like. So the younger men actually respond really well.
How old is this an effective treatment? How old have you treated?
I have treated 70. 67, 70, older, in the 60s. I have yet to treat somebody older than 70.
They respond. It's effective. They respond?
A guy 67, I was very surprised he was a smoker. A smoker will kill. If you're smoking, it's going to kill your sex life when you get older. It's going to mess your blood vessels up. If you want this to work, if you come in and you're smoking, I'll tell you to quit. You've got to let this tissue heal.
Well, that makes all the sense in the world. We're going to talk more about this treatment, and if you'd like to ask a question of Dr. Hough, you can do that at 447-1190. We also have the text line open, of course, 46862, 46862. We're talking about acoustic shockwave therapy, a new treatment available for erectile dysfunction, and we're back with more on the HealthCall Live Radio Hour on WOWO.
Now, back to health and wellness correspondent Lee Kelso.
And we are back to our discussion of erectile dysfunction and a new treatment that does not use medications. It uses sound wave therapy. It is offered by Dr. Gregg Hough of the ED Clinics of Indiana. He's here in studio with us. If you have a question, you can ring in at 447-1190 or toll-free 800-333-1190. Or if you're a little bit shy, you can always just use the anonymous text line at 46862, 46862, and we will answer your question. Dr. Hough, we have Sandy on the line, so put those headphones on so you can hear her. And Sandy, what's your question for Dr. Hough?
I was wondering if this works if the man has had his prostate removed.
Oh, that is an excellent question. Okay.
Well, again, that depends on his overall health, but the prostate is not necessary. It depends on the procedure, too. A lot of the newer procedures are very good at avoiding any of the nerves that have to do with stimulating an erection. So, as with anyone who gets their prostate removed, you're going to have some that will have trouble coming back, but many men do. It takes 3 to 6 months if you don't take anything. But again, ED has to do with the blood vessels and the in and out, and increasing and restoring the blood vessels of the penis. So yes, it will help. It depends on the person. If the person is healthy and they've had trouble and they have their prostate removed, it looks like a good prognosis.
Sandy, how long ago was that procedure?
It'll be a year in November.
Okay, so pretty recent surgical technique there. A lot of the more recent surgeries with prostatectomies are designed to really protect that integrity of the nerves. So if it was something that was done many years ago, that was pretty crude surgery, but now they've gotten a lot better in that technique. So I think Dr. Hough's on the right path here. I think it could help.
One more thing, if the person was functional before the surgery, quite functional, and now they're not, he's only been a year into having any kind of atrophy or anything, so that would be easier to restore too. The blood vessels still be pretty strong and healthy.
Sandy, thank you for your call. Appreciate you listening. So let's talk a little bit more about the procedure itself. When I come to see you, how does this all work? What happens?
Well, we have you come in and we have you fill out a standard form that helps us to understand. It's done by all doctors, urologists, to understand the level of your deficiencies and how much needs to be done. We talk a little bit about the procedure, as I'll talk now. Once the man decides to do it, what we do, I'll tell him to disrobe from the waist down. I will leave the room first. We lay him down on a nice towel, on a nice cot to lay down on, and then when they're comfortable, they open the door just a crack, and I give them a minute to go over and lay down and cover themselves again with another towel. It's very discreet. You don't feel exposed. You don't feel vulnerable. And then I come back in, and we start, and the machine. The patient himself is the only one touches himself, but the machine, we have them pull their testicles up, and right where the prostate enters and the blood vessels and everything enter the penis, we stimulate that for about 1,000 clicks. The machine does 3 clicks per second. So we do 3,500 clicks total. It's very easy. I have the machine set at 500, so we just smoothly go along. So we do 1,000 clicks where the prostate enters, and then after that we go to the base of the penis on the left and on the right and give it 500 clicks each, and then we come up about halfway up the shaft on 500 clicks each on either side, and then we lay the shaft down and we go up and down the whole shaft for another 500 clicks.
Do I feel anything during this process? Because it's a pulsed sound wave. So is there any discomfort or pain at all?
Every once in a while, you'll feel a little sharp tinge, but if it does, we turn the machine down, or there might be some points where the nerves are extra sensitive in one place, and we just move away from that. And you're going to feel as if you're having a very mild shock. It's not scary. It doesn't hurt. Mm-hmm. You don't have to turn it up. What makes the blood vessels restore is way below any pain level you'd have to experience. You have to understand you're going to feel something, and that actually you should be glad that you feel something. And some people who have been, their nerves haven't ran very well, it might take a couple visits, and they'll go, well, I'm starting to feel something. And I say, good. It's kicking back in.
So how soon will I begin to notice some potential benefit?
Well, again, on your age, I've had one man in his 40s felt a benefit the next day, one guy in his 70s overnight. Realistically, probably in 2 to 4 visits, you're going to start to have nocturnal erections. You're going to wake up in the middle of the night, and it's very comforting. It's like, wow, that hasn't happened for 10 years. And so, go ahead.
Well, you wouldn't be here if there wasn't good science behind this. So I took a look out at a number of different studies, and there are studies that show, for one of them, for example, had 20 men age 56, and 14 of those 20 showed an increase on that scale you just mentioned, that universal screening scale, of over 7 points. So, there's good science behind this therapy. I understand that. So, tell me what people are saying about this. What kind of feedback are you getting from patients?
Well, again, as a man, when you get older, and I think we all, there's something in us that even if you're married, if you're single, to have the ability to perform the sexual act is part of who a man is. And when you see these men start to get their dignity restored, one guy, the one guy was 42. He came in after his fourth treatment. He said, "My wife told me that I have to tell you this." She said she wants to personally thank you for what is happening to me. And another guy in his 60s, I was walking into Casa restaurant, and him and his wife were leaving, and she joked, but she said, "Turn back around and let me roll down the window and give Dr. Hough a high five." Men get older, they love their wives. They want to have that communication, that deep intimacy. And when you start to lose that, a lot of men feel insecure. They don't know what's going to happen. They don't know how they're going to feel. And when that is given back to you, you feel really good about who you are.
I could see that. So let's talk about costs. That's always the big question. This is not anything an insurance is going to cover.
No.
So how much does this procedure cost?
It costs $3,200 for 6 treatments. If you are older and you might need a few more after that, we'll charge $400. It might take, I've had where it's taken actually 9 treatments. But when you get to 6 and you're almost there and you're starting to feel better, but it's not quite enough, I don't think anyone minds paying a little extra. But a young man at 6 treatments, he's back again.
And a couple years down the road, do I need a touch-up, or can I do this more than once?
Some people might. Some people, it depends on your health. As much as this is as close to a silver bullet there's no silver bullet. And if you're healthy and you take care of yourself, it's going to last longer. If you're not, diabetics, within 2 years, many of them start to lose this. And again, if somebody is enjoying their life and they want to come back, yes, they can be revived again. You can revive the person as much as it takes. If you don't want to exercise and you don't want to do anything, but it works, you can come back, and it'll always work.
Yeah, well, obviously it's better to take better care of yourself.
Yes.
So there is a condition known as Peyronie's disease, which involves curvature due to scar tissue.
Yep.
Now, I've read some research that says this can effectively correct that without surgery. Is that right? Have you seen this?
Yes. I've had one with Peyronie's disease. The thing is this sound waves break up scar tissue. And Peyronie's is the curvature of the penis because something has damaged it, and as it's healed, that elasticity of the tissue is lost and it scars, and so then when the man gets an erection, it's going to curve. And so the Shockwave will actually break up that scar tissue. It will improve it a lot. I haven't had anybody who's had minor. The man that I had he was diabetic, and it was fairly severe, and he was probably 50% better. I'm just being, straight here.
Right.
And he was pleased, though, because he was straighter than he'd been in years.
Well, that's
so yes, it does.
What's next with this therapy? Do you see, is there new devices, new research? What else is coming down the pipe? Anything that you're aware of?
Not yet. I think a lot of it is fine-tuning the equipment we now have. I try to look around and find treatment protocols of other doctors, what their success is, what frequencies they're using, how many times they're doing it, a lot of different things like that. A lot of men, if they get older, I do not recommend they take testosterone. You can get HCG, which is human chorionic gonadotrophin, which will stimulate the human testicles to produce testosterone. Very safe. Some men get older, they need that. You can have that done. You can get your doctor to give you injections. And that's perfectly safe, and it will not leave any detrimental effects on you.
Well, we have to leave it there. We run out of time. That is Dr. Gregg Hough of the ED Clinics of Indiana. You can find them online at edclinicsofindiana.com.